What's up, TUMNAD lectures? In this video, we are going to take a look on what we call fetal circulation summary. If you find this video helpful at the end of it all, please make sure you like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. So now, in the previous video, we looked on what we call fetal circulation before birth, and even also we looked on what we call the events that happens after birth in great detail. In this video, we're just going to have a summary of each one of them, the fetal circulation before birth, and even also some of the events that happens immediately after birth. Let's go ahead and get started and look on fetal circulation summary before birth. And of course, we said that fetal circulation is going to be the movement of the blood from the maternal side through the placenta to the growing fetus, meaning that our fetal circulation before birth is starting from what we call the placenta. Now, this placenta, we said, is everything during fetal life. It is only responsible for what we call gas exchange, okay? The pulling of oxygen from the maternal side through what we call the chorionic villi to what we call to the placenta, okay? We also have what we call the movement of what we call the nutrients from the placenta, and even also don't forget what we call waste removal, like for example, the CO2. Okay, and besides that, we also have what we call immunoglobulin passage, like for example, immunoglobulin G, which is going to be providing what we call passive immunity from the maternal side. This is always a gift that's always given to the baby after it's born from the maternal side. And of course, we also have what we call hormonal function, whereby it's going to be providing a lot of the hormones, like what we call hormone HCG. Okay. So now our blood from what we call from the placenta, which is going to be having a lot of the oxygen, a lot of the nutrients, will move to this kind of the beautiful kind of the blood vessel, which we call the umbilical vein. See, this umbilical vein is going to be carrying blood which is oxygen rich, having approximately 80% of oxygen, and even also rich in what we call nutrients. From the umbilical vein, we said that this umbilical vein is going to be coming around the liver, whereby it's going to be having this beautiful kind of the shunt that's going to be making sure that the blood bypasses what we call the liver. And we said that this kind of the shunt was what we call the ductus venosus. It was shunting this blood to bypass what we call the liver, direct from the umbilical vein, direct what we call the inferior vena cava. The inferior vena cava, we said that they are going to be what we call mixing of the blood. Blood coming from what we call the ductus venosus is going to be rich in oxygen and nutrients, but of course when it reaches what we call the inferior vena cava, is going to be mixing up with the blood which is going to be coming from the lower extremities, meaning that in inferior vena cava you're going to be having mixing of the blood. From the inferior vena cava, this blood is going to be moving into what we call the right atria. Now, it is something beautiful what's going to be happening in the right atria. Two things are going to be happening. We're also going to be having blood which is going to be coming from what we call the superior vena cava, and that blood is going to be deoxygenated. And this blood, approximately 20% of this blood will proceed to what we call the right ventricle. Okay, and of course from the right ventricle, it will push this blood to what we call to the pulmonary arteries. Eventually, from the pulmonary arteries, we're going to be having blood being shunted to what we call the ductus arteriosus. Now, something which is so much beautiful, we said that during fetal life, we're going to be having a lot of extensive kind of the resistance in what we call the lungs by the mechanism which you said, which was what we call hypoxic vasoconstriction. Because of that, we're going to be having a lot of the pulmonary resistance, which is going to be increasing a lot of the pressures within what we call the pulmonary arteries, which is going to be backing that pressure to what we call the right side to the right ventricle. And of course, that's what we said. Now, during fetal life, you're going to be having high pressures within what we call the right side of the heart. Okay, and that's why blood which is supposed to pass in what we call the pulmonary arteries to the lungs is going to be shunted to what we call to the ductus arteriosus, which will eventually meet what we call the aorta. But the beautiful kind of the mechanism which is so much important is that blood from what we call right atria, approximately 70 to 80% is going to be passing through this beautiful kind of the shunt, which we call the foramen ovale, which is going to be residing in what we call the interatrial septum. This beautiful kind of the hole, which we are calling the foramen ovale, is helping to shunt 70 to 80% from what we call right atrium, and then it drops into what we call the left atrium. And of course, this blood from the left atrium, it will move down past what we call the bicuspid valve into what we call the left ventricle. And of course, the left ventricle is going to be squeezing this blood as if they never squeezed before to enter into what we call the aorta. And of course, in the aorta, we said they're also going to be having blood from what we call the ductus arteriosus, which is going to be a shunt that enables blood to bypass what we call during fetal life, what we call the lungs are not functional. Okay, so now we said that and this blood is also going to be joining what we call the aorta, and of course the aorta is going to be having the ascending aorta and the aortic arch, and even also what we call the descending aorta. So now this blood will be going now to be supplied to the different body parts or what we call the growing fetus, and eventually and the descending aorta will move down and then split into what we call the common iliac arteries. You're going to be having what we call the right and then the left common iliac arteries, which will also eventually break into what we call the external iliac arteries and then even what we call the internal iliac arteries. And we say that on the internal iliac arteries, we are going to be having these beautiful kind of the arteries, which we call the umbilical arteries. And it is within these umbilical arteries that we are going to be having blood which is having a lot of the CO2. And this blood is also going to be deoxygenated, but of course I don't like using the word deoxygenated because this blood is also going to be carrying some little percentage of oxygen, approximately around 50%. And this blood in umbilical artery is going to be having a lot of the waste, which are going to be driven back to what we call to the placenta, and then it goes to what we call to the maternal side in exchange with what we call the oxygen and what we call the nutrients. And then from the placenta it will go back. You go back to what we call umbilical vein, and then the process repeats again. Okay, so now that's what's going to be happening is what we call fetal circulation before birth. Now we want to see what is going to be happening immediately after birth. What are some of those events that are going to be happening after birth? And of course, when you say after birth, it means you're going to be having now our umbilical cord being cut. And of course, when the umbilical cord is cut, it means that the placenta is no longer playing any role to the what we call to the fetus. The fetus has to survive on its own. Because of that, the fetus is going to be taking his or her first breath of life. Okay, it's going to be taking her first breath of life and will make a very beautiful kind of the cry. That kind of a beautiful kind of the cry, it tells us that the lungs that have been collapsed all along for the 9 months have finally received the first brand new kind of the oxygen and making them to dilate. And because of this kind of oxygen, we're no longer going to have what we call vasoconstriction in what we call to the lungs. We are going to be having now the pulmonary arterioles going to be dilating, and because of that, you're going to be having a reduced kind of the resistance in what we call the pulmonary circulation, meaning that you're also going to be having a drop in what we call the pressures within what we call the pulmonary arteries, and eventually also the right side of the heart, you're going to be having a reduced kind of what we call the pressure. It is during this time you're going to be having now a lot of the blood pass into what we call the pulmonary circulation, into what we call the pulmonary arteries, pulmonary arterioles, and then to pulmonary capillaries, then pulmonary venules, then the veins which are going to be bringing back the blood into what we call the left atrium. Meaning that during this time, you're going to be having an extensive amount of the blood coming to what we call the left side of the heart. And that is also going to be increasing pressures in what you call the left side of the heart. Now, when the baby is born, we are going to be having an extensive amount of the pressure generated into what you call the left side of the heart compared to what we call the right side of the heart. And because of that, we are going to be having a lot of the structures which we don't want when the baby is born. Whenever the umbilical cord is cut, there are different structures which we no longer want to exist. What are those structures? We no longer want this beautiful structure which we are calling the umbilical vein. And for that reason, this umbilical vein, after birth, is going to be becoming a fibrotic tissue, which you are going to be calling the ligamentum teres. Okay, which are calling the ligamentum teres. And then after that, we no longer need this structure which you are calling the ductus venosus, which was a shunt which was helping to bypass blood away from what you call from the liver directly to what you call the inferior vena cava. Now, when the baby is born, we no longer need the ductus venosus. It becomes a fibrotic tissue which we call ligamentum venosum. It is such another beautiful thing. Now, again, after birth, we no longer need this structure which we are calling the foramen ovale. Okay. And because of that, we need this kind of a beautiful foramen ovale to close, because we no longer need blood shunt from what you call the right atrium to what you call the left atrium. And because of that, this foramen ovale is going to be turning into a fibrotic tissue or ruminant, which you call the fossa ovalis. Okay. And then when we move into what we call this structure which we are calling the ductus arteriosus, we no longer need this ductus arteriosus because now the lungs are functional. We need this blood to go into what we call into the lungs. And because of that, there are three factors that are going to be favoring the close of what we call the ductus arteriosus. Now, before that, for this ductus arteriosus to stay open for the rest of the baby's life in utero, it needs what we call low levels of oxygen, low levels of bradykinin, and even also high levels of what we call prostaglandin E2. Now, because the baby is born, we are going to be having now an increase in what we call oxygen, and that one is also going to be helping in the close of what we call the ductus arteriosus. We're also going to be having a lot of what we call bradykinins, which also favors the close of what we call the ductus arteriosus. And besides that, we're also going to be having a reduction in what we call prostaglandin E, and all those three kind of the factors, high levels of oxygen, high levels of bradykinins, and low levels of prostaglandin E are very, very, very enough to make sure that the ductus arteriosus closes successfully. And if it doesn't close, we shall end up with what we call patent ductus arteriosus. And this one is going to be presenting some beautiful kind of the mammals which are going to be had during what we call clinical examination. Okay, but this kind of the beautiful kind of the ductus arteriosus is supposed to close, and once it closes, it becomes this beautiful kind of the structure which we call the ligamentum arteriosus. Sometimes if this beautiful ductus arteriosus doesn't close, there's a beautiful kind of the inside that can help in the close of what we call ductus arteriosus. And that kind of the inside is what we call the indomethacin, because indomethacin has the ability to block what we call an enzyme cyclooxygenase, which helps the breakdown of what we call arachidonic acid into what we call different kind of the prostaglandins. Now, if we block cyclooxygenase, we're going to be reducing the levels of what we call prostaglandins, which also enhance the close of what we call the ductus arteriosus. Okay, it is such another beautiful thing. So now we also have some other structures which you no longer want. You see this structure here which you're calling the umbilical arteries, you no longer want them. Now the question is, what do they turn into after birth? It's going to be turning into two beautiful structures. And the first one is what we call the medial umbilical ligament, and another is going to be what we call the superior vesical artery, which is going to be supplying the superior aspect of what we call the urinary blood. It is such another beautiful thing. So now again, the last one is what we call the allantois. The allantois is something which is so much beautiful, located within what we call the umbilical cord, and of course eventually is going to be turning to what we call the urachus, which will finally generate into what we call median umbilical ligament. Okay, so now you're going to be having what you call the median umbilical ligament. It is such another beautiful thing. So now that briefly covers what we call the events that are going to be happening, what we call after birth. Thank you very much for watching, and if you think whatever I've talked is really making sense, is adding to you, you are benefiting, please can hit like button, comment down in the comment section, and please subscribe. Thank you very much for watching. It has been TUMNAD as always. Until we meet next time.